welcome you here to the Woodrow Wilson International Center for Scholars. We are a federal trust instrumentality, so some of our staff is on furlough at the moment, but we're very glad that many of you could come to this event regardless. I'd like to mention the 2011 Social Media and Emergency Management Camp Report. One of the first reports that came out on the role of social media in emergency management. I think Red Cross had one the year before, which is still, I think, a really good read. Last year, the Wilson Center hosted an event called Connecting Grassroots to Government for Disaster Management. So how government might be more innovative in the use of social media, crowdsourcing, and crowd mapping approaches for disaster response. And it's with great pleasure today that I introduce our distinguished panel to talk about 3 reports, I think, coming out. The Red Cross 2013 World Disaster Report, which focuses on the use of technology and innovation. Sabrina McCormick, who did work for the Wilson Center as a public policy scholar, doing some in-depth interviews with the local emergency management on their use of social media and crowdsourcing. And Clarence Wardell and Yi San Su, both are CNA safety and security research scientists, and they'll be talking today about their new Social Media and Emergency Management Field 2012 survey results. So with that, I'm going to hand it over to Clarence, although I should note if you tweet hashtag SMEM for Social Media and Emergency Management, or hashtag SMEM 2013. All right, thank you very much. Clarence.
Hey, good morning. Glad everyone can make it out of this shutdown. Can you hear? Can everyone hear me?
Yes.
Okay, great. Good morning. Glad everyone can make it out. Thank you, Leah, for the introduction. As she mentioned, we were here about approximately 2 years ago at this time, discussing at that point the Social Media and Emergency Management Camp Report, which was basically a summary of a workshop that was held at the National Emergency Management Association mid-year conference earlier that year. It was a convening of about 150 emergency managers, well, not emergency managers, but stakeholders from the emergency management sector within the U.S. And I think it was our first kind of large-scale attempt to really understand how social media and new technologies were affecting the U.S., specifically emergency management community. Sitting to my right here is Wendy Harmon, Director of Information and Situational Awareness at the Red Cross. And so you mentioned 2010, they had the Crisis Data Summit at the Red Cross, which I think was certainly my first introduction kind of to this area, and I think it was precipitated in large part by a lot of the innovation that we saw around new technology in the aftermath of the Haiti earthquake. And so at that point, a lot of it was focused internationally, and a lot of the innovations that we had seen there. And so what we wanted to do with the SMEM report was really focus it domestically and try to discuss some of the unique aspects and challenges of these new technologies, not just the technologies, but the way that citizens were using these technologies were affecting those in that community. So when we released the report, we made several recommendations based on some of the conversation at that workshop, but also a lot of the popular press and literature at that time around what were some steps forward. And so one of those recommendations we wrote was baseline establishment. And it was honestly to conduct a survey of domestic emergency management agencies to provide a baseline of social media and mobile technology capabilities. And that was one of about 5 recommendations. I don't know if we have a ton of copies of the report left. I believe there's one out there. But if you're interested in it, it's on the Wilson Center site, it's on CNA's site. If you can talk to me afterward, and I can also shoot you an email of the report. But so that call for kind of a baseline establishment came out of not just that conversation, but really 2 other things that we saw are going on or around the conversation in the space. And one was the Red Cross had done a series of surveys of the general population, just to understand how they were using social media and new technologies around disaster response and what their expectations were. What we discovered at the conference was it was great that we had kind of that side of the equation, but we didn't really know kind of on a broad level what were emergency managers thinking about this, right? So on one hand, you had citizens expecting that within 24 hours, 3 days or something of posting requests for help on someone's Facebook page or Twitter message, that some type of help would be received. Right? Well, did that align with how emergency managers were operating? Were they even looking or thinking of these new data sources as places to receive requests for help? And then the other piece of that, we also began to see a lot of conversation at the federal level around how can we help state and local emergency managers to better implement these technologies and to kind of grease the skids, if you will, to get folks moving forward. And so there was a congressional hearing, I believe, in May 2011, actually right after that first report, and there were several congressional hearings this past summer, actually, on how can government work with the private sector and also public sector entities to advance new technologies in this area. And then kind of one of the things that we were talking about is we just felt that as the federal government was trying to understand how they could best help, they really needed to go out and ask, emergency managers, not just on a one-to-one level, but as a broad survey as we could get, what were the expectations, do they need the help? Were the issues that they were facing really something that the federal government could actually help, or was it something that really needed to be handled on the local or just cultural level? So that's kind of why we're here today, and that's why Yi and I pursued the Social Media Emergency Management Survey in partnership with the National Emergency Management Association. Dr. Sabrina McCormick has done some work actually. Going to consider more of a deep dive, talking and interviewing a lot of emergency managers, particularly in the Northeast, right after Hurricane Irene. So with that, I'm going to stop rambling. I want to introduce my panelists, and then really turn it over to them to talk about the reports, talk about their experience actually using these technologies, what are some of their issues, kind of interacting with the new kind of informal emergency management community, and then turn it over to you all for questions. So to my left here, I have Ms. Wendy Harmon, Director of Information and Situational Awareness at the American Red Cross. Wendy Harmon is a proud Red Crosser and a digital nerd. In June 2013, she accepted a new role in the American Red Cross Disaster Services to lead the creation of a common operating picture during the disaster response efforts as well as for preparedness and recovery. She previously served as the Director of Social Strategy. In this role, she led the organization towards becoming a social organization ready for 21st century humanitarian work. She was responsible for the national social media presence, including the listening program, social content, and community engagement. She developed the Digital Operations Center, where the organization now endeavors to give the public a seat at the table of domestic response via big data, situational awareness, individual needs routing, and via individual engagement. She conceived of the Red Cross digital volunteer role and coined the phrase digital hug. She frequently speaks and writes about issues at the intersection of nonprofits, technology, and the social web. In 2010, 11, 12, and 13, she was named to the Nonprofit Times Power and Influence Top 50 list. And this is the most impressive, I think, accomplishment I'll wrap up here. She taught President Obama how to tweet in 2010 and is often cited for her smart handling of the getting slizzard tweet. If you haven't heard that story, I can pull her aside afterwards. She'll be happy to share. So thank you, Wendy, for being here today. To my right is Dr. Yi San-Soo. Since 2008, Dr. Yi San-Soo has been a researcher at CNA's Safety and Security Center, and my colleague. He has worked at both the state and federal levels, utilizing a variety of analytical, statistical, and modeling techniques to support emergency preparedness assessments. Dr. Soo has supported high-profile assessments for legislative and executive branch holders, serving as a task lead on the 2012 and 2013 National Preparedness Report, and the project lead on the 2013 Emergency Support Function Report. In 2011, the Center for Homeland Defense and Security named him the winner of its national essay contest for his essay on the challenges of assessing national preparedness. Prior to CNA, Dr. Soo spent 2 years as an American Association for Advancement of Science and Technology Policy Fellow in residence at the National Homeland Security Research Center. Before being awarded the AAAS Fellowship, Dr. Soo was a technical consultant at Exponent Inc., a leading engineering and scientific consulting firm. He has a PhD in chemical engineering from the Massachusetts Institute of Technology and is a licensed professional engineer in the state of Illinois. Last but not least, to my far right is Dr. Sabrina McCormick. Dr. McCormick is a sociologist and documentary filmmaker who investigates the social dimensions of climate change. She is associate professor in the Department of Environmental and Occupational Health at George Washington University School of Public Health. Dr. McCormick has been funded by the Center for Disease Control to study heat wave impacts in urban America, by the National Science Foundation to examine the role of citizen science in assessing effects of the Deepwater Horizon spill, and the Robert Wood Johnson Foundation to study health impacts of climate change. She is currently associate producer on the first television series about climate change entitled The Years of Living Dangerously, to be screened on Showtime in 2014. I believe she just returned from 3 weeks of shooting abroad.
Bangladesh, yeah, Wednesday night.
Wednesday night, so happy to have you here with us. So I just want to start out, and actually really just open up the floor and allow you two to talk about two of the reports that we're here today to talk about. So one is the Social Media Emergency Management Survey, which you was really kind of the lead in putting that survey together and ushering that out and doing a lot of the analysis on the back end. So you don't mind just kind of opening up, telling us a little bit about the survey, how it came about, and what were some of the major findings from that?
Sure. Clarence has already talked a bit about the survey itself, so I'm not going to spend a lot of time on kind of rehashing things. Like Leah mentioned and Clarence mentioned, this particular survey was in part motivated or heavily influenced by the 2011 SMEM camp. One of the things that I most enjoyed from that camp were the anecdotal stories or accounts that were related by social media champions in various emergency management agencies. And the flip side of that, however, was this kind of broader issue of, well, what are the activities going on a national level, nationwide? And so, again, one of the recommendations from this white paper was to conduct a baseline study, and this survey is basically to fulfill that particular recommendation. As far as kind of details of the survey itself, 56 questions, issued as a web-based survey. Through NEMA, we basically sent the survey link to state PIOs, public information officers, and then also asked them to forward along the survey link and encourage participation from their state, from their county and local counterparts. As far as key findings, they're listed throughout the report. I'm not going to belabor that, but one takeaway that I did want to mention that struck me in terms of the survey results was this, the fact that we're still at kind of this stage where the emphasis is on the public communication side of using social media as an additional avenue to communicate out. And from the standpoint of how do we best integrate virtual or volunteer technology communities, things like virtual operations support teams, into our kind of domestic emergency management efforts to capture some of the additional benefits that are out there as far as monitoring and so forth.
Thanks, Steve. Sabrina, could you talk a little bit about, so Sabrina's report, I think, was really interested in how emergency managers use social media after Hurricane Irene, and you spent a lot of time in the Northeast talking, I think it was 19 emergency managers. Could you talk a little bit about how that came about? What were some of the major findings of the report, and then how did you, what were the individuals that you talked to? Were these all kind of champions of social media within the organization, or was this a broad spectrum of folks?
So I'm gonna get this close enough to my face. So I started this piece of work with Woodrow Wilson Center right after I had been working on 2 other projects that really inspired me to take this particular approach. So I just finished being a lead author on the IPC, the Intergovernmental Panel on Climate Change's Special Assessment on Extreme Impacts of Climate Change, in which I wrote the section on communications around extreme impacts of climate change, and in so doing was finding there really wasn't very much work that allowed me to draw conclusions about the role of social media in responses to extreme weather events around climate change or related to climate change. And for those of you who aren't very familiar with the work of the IPCC, in many ways it's a glorified literature review, so you can really only draw from the literature that's been published. Sometimes gray literature, but generally the white literature. And I was also just finishing another piece of work funded by the National Science Foundation about the role of citizen science and social media in particular, really the Ushahidi-based maps that local informal disaster responders were using in order to detect real-time impacts of that disaster, and was looking in depth at the ways in which those local responders were capturing really the only database of real-time impacts of that disaster, and looking at how those data were being used or not being used by policymakers. And that debate about whether or not to use those data continues to play out today, in lawsuits, in policy, et cetera. And so the place from which we began this report was to just think about how, in many ways, social media was being considered as this kind of boon for disaster responders, at least informal ones, but there really had only begun to be initial research on the role of formal disaster responders in the way that they were using social media. We took a really different approach with this piece of work than you all took with your survey. So we took an in-depth qualitative approach to look at really the processes of thinking, the institutional characteristics, the logic around why formal disaster responders would or would not use social media during or before a disaster. Why would they engage with these new forms of technology, or why would they ignore them? And so I interviewed 19 disaster responders who were really working at the local level. These are all pretty down on the ground responders across the Eastern Seaboard, and then some on the West Coast as well, starting from the premise of thinking about Hurricane Irene as what appeared to be and what had been called a watershed moment in the engagement of formal disaster responders with these technologies. But as I began the research, or as I began to get more in depth in the research, it became clear to me that in fact Hurricane Irene was only in some ways a watershed moment. It was important, but the folks who I was interviewing at least had been thinking about these issues, had in some cases already been engaging with these technologies before Hurricane Irene, and had continued to think about the issues that affected their engagement with those technologies afterwards. And so I really broadened the research questions and the scope of the interviews to think outside of just that one event and think about other disasters and extreme weather events. I won't talk too much about the particular findings of the report, because I think those will come out as we talk today. But what I found, I guess most simply put, is that we're really in a state of transition around the incorporation of these technologies in formal disaster responder portfolios of what they do and what they would like to do, and that there are really two different kinds of challenges in their adopting these technologies. One set is internal, so involving staffing, guidelines, policies within their institutions, and one is another set is external challenges, particularly around distrust of information, fear about its usage, and uncertainty about what the data actually mean in the kinds of social media data that they might end up using. Can't remember if you asked me any other questions that I'm not answering, but I'll just start with that.
No, so that's great. I guess if we could dig down just a little bit deeper, one of the things that you and I outlined in this original report was this kind of, and it was it wasn't our original concept. It came up at the workshop. One of the emergency managers, actually, a public information officer, was talking about this progression of use of social media, and starting out first is just kind of this. You don't even have to have a Twitter account just to go and look and see what's being said. And then progressing from there to using it as kind of a broadcast tool or a one-way informational tool. So you see a lot of agencies sometimes just putting information out and they never respond to anyone. And then the kind of second piece would be that two-way communication of that dialogue. And this kind of fourth piece of almost crowdsourcing, leveraging the crowd and actually getting folks to do things via this kind of digital interaction. And so, I know, Sabrina, you had kind of a similar taxonomy there, or progressive scale. I'm just interested from both of you, how are emergency managers using it? Have they gone, are they using it at that kind of fourth highest level of crowdsourcing, or is it still more at the kind of broadcast level, or is it somewhere in the team in between?
The findings from the survey pretty much emphasize the fact that we're predominantly at the broadcasting stage right now. And for the reasons that I mentioned before, even though there is a lot of interest in potentially interacting with volunteer technology communities, that hasn't really taken place yet. And so what ends up happening, especially in large-scale events, there just isn't the capacity, there isn't the manpower to keep up with some of these monitoring efforts that in turn lead to things like rumor control and whatnot, and direct interaction or dialogue. So that's where we're at. As far as kind of the crowdsourcing component, you know, one of the interesting aspects of the surveys, we did actually ask folks to define their concept of what social media was through various tools and various ideas. And crowdsourcing was one of the least frequently cited items, probably from the standpoint of just understanding or familiarity with that term. So if there isn't that kind of, if that's not in your vocabulary, it kind of signals, or it's a little bit difficult to kind of actively being able to apply it.
So I like to sometimes say that the difference between quantitative and qualitative research is that quantitative does the what and qualitative does the why. And so I love this combination that we have here. So you've got these survey results which tell us a bit about the proportion of folks using these kinds of technologies, and I can, from the qualitative side, say a little bit about why there's this kind of limited engagement. So I would say from the 19 interviewees who I spoke to, that the majority of them are still pretty reserved about their usage of social media and crowdsourcing. And you know, there are a whole slew of reasons for that. There are not that many people who are actually tasked with engaging in these technologies. There are actually specific guidelines which prohibit some kinds of disaster responders from engaging in these technologies. So for example, I spoke to a chief firefighter in one city who said literally the firefighters are not allowed to take their phones out into the field with them. And so if you don't have your phone, you can't tweet, you can't really engage at all. And they consider it a hazard for these firefighters to have their phones as a distraction. It's potentially problematic in their response measures. And that's just one example of many that I heard from these folks in terms of why they're not engaging. Oftentimes, responders who have begun to push information feel kind of bad about the fact that they don't have the staff time to also respond to requests from the public, to information being fed back to them through their Facebook page or through tweeting or through any particular kind of mechanism. And so they might be beginning to make the foray into social media and crowdsourcing, but really only in a very limited way. And so we see in different places, different degrees of engagement, depending on a number of factors. So leadership, high-level leadership, and even just in a locality can really make a difference. So if you have a mayor or a head of an agency who's saying, yeah, you guys, this is great, you should be engaging in this way, then you're more likely to find staff in a variety of agencies who are able to then say, oh, well, I can take time out of my schedule to do this kind of work. Or, okay, you know what, he or she trusts this information, so I should also. So high-level leadership is one way in which this kind of work can move forward. Oftentimes, though, leadership isn't there for it at the high level, and so what you see is more mid-level staffers beginning to just try it out to varying degrees, depending on their own proclivity to it, their own familiarity with the technology. And then sometimes their colleagues at their own level will kind of catch on and say, oh, well, she's doing it, so you know, maybe I'll try it too. So there are a number of different ways that this process moves forward.
Actually, just to build and talking about this kind of nice quantitative, qualitative balance between the in-depth interviews and the survey itself, that was a couple of points that were just mentioned, you know, in terms of feeling, you know, that sentiment of feeling bad about not being able to have that dialogue That was found in the survey results. Basically, when we asked folks to talk about their response to a large-scale, their experience with a large-scale disaster and how they use social media, the number one issue that kind of popped up was that inability, or the inability to kind of create that dialogue, or as well as kind of the lack of staff to be able to keep up with monitoring efforts so that it could create that dialogue. And towards that, the issue of governance that Sabrina was talking about as well, one of the interesting things to me in the survey, when we talked about, we broke down capability into various dimensions, one of which was governance, was the very large gap between high-level buy-in from at the state level versus the county and local level, where there was a very dramatic drop-off in terms of the buy-in that we were seeing from the respondents.
Thank you. Wendy, I did not pick it up. But I think that's kind of a perfect segue as we talk about, emergency managers not being tasked with engagement, not being able to have that dialogue. Correct me if I'm wrong, but at the Red Cross, that was your primary role for a while, right? Is being tasked with that type of dialogue, engagement, digital hugs. Could you just talk a little bit about, I don't know if everyone here is familiar with the Digital Operations Center, and you talk with people in the federal government that frequently kind of refer to what the Red Cross has going on over there. It's almost like the gold standard of what they aspire in terms of social media engagement, situational awareness, what have you. Could you talk a little bit about the Operations Center, your role there, and that type of engagement and dialogue that you've been able to create, and what some of the challenges are?
Sure. So we, at the Red Cross, just a tiny background, have started a social media program in 2006. So we're pretty early to the game and had several years under our belt of sort of figuring out the waters in this space. Before, well, we had Ike and Gustav in 2008 to really test us, and then, of course, Haiti in 2010, which really opened our eyes to this idea that, mostly because we were seeing lots and lots of tweets from the Haitian diaspora community in the United States saying, at Red Cross, my cousin is trapped in the rubble, just got a text message from her, they can hear the rescuers, please come and do something. So, those kinds of tweets were sort of landing like a thud on our screens or on our shoulders, because we didn't have any mechanism for dealing with, there was no action to be taken from seeing that tweet. Although we did, reach out to the State Department, and I was naive at the time, so I ended up on the phone with several of those family members and trying to, really do anything that we possibly could, but to try to route that stuff. So it was really a realization, even though before that, we were all talking about this two-way dialogue and how do we really embrace it for organizational purposes or whatever. That was the moment where I really began to think, this is a really powerful tool, but it's really no different than the telephone. These same kinds of calls were coming in during Hurricane Katrina with people on their rooftops saying, when is the helicopter coming? And that same thud was happening. And so really this is a matter of figuring out something different in how we're structured. So we've had a lot of practice here, and then about a year and a half ago, March of 2012, we opened the Digital Operations Center, which is housed inside of the Disaster Operations Center at headquarters of the American Red Cross. And in there, what we're doing is using a pretty robust software system. There's screens on the wall. If you've ever, how many of you have been there? Yeah. So I assume that everyone in the universe has. Given approximately 800 tours. So what happens in there? It's a simple room, and it has screens on the wall that have data visualizations of various social media conversations that are happening about a given event or a steady state event. And what the DigiDoc does really well is provide situational awareness in real time. So if we begin to see a that there was a bus crash in Knoxville, Tennessee the other day. We'll usually see that kind of thing first on the screens up there. And can begin sort of getting some awareness of what is happening on the ground in sort of broad strokes. And we have been able to, during major disasters, create specific buckets or topic profiles and visualizations for those specific events and really get a holistic look at what's going on the ground, not just for Red Cross services, but across the spectrum of what's happening down there, but wherever it is. And we've also been able to develop reporting mechanisms and really have been integrated, that data has been integrated pretty well into all of the other kinds of reporting within disaster services throughout the organization. And so everyone who works with the Red Cross now is pretty used to looking at this data for situational awareness. We're also, as we mentioned in the bio, pretty proud of the digital volunteer role that we've built to sort of help include more people on the volunteer side in helping match up anybody who might need tips or resources or information about what's going on or where they can get Red Cross services or any other kind of services. So we have a pretty robust training program now for that, and we've been able to do that engagement not on a crowdsourced basis, because we have not ever said y'all come. We've only caught as we can certain scenarios within a specific disaster. So when there are tornadoes, or warnings, we'll begin to see hundreds of people using #bathtub, and there's a very big emotional component to being in a tornado warning. I'm sure probably most of us have experienced that. It's scary. And so our digital volunteers will hop into the software system and begin to find those people, connect them with one another, because they often feel a little bit alone in their bathtubs, and they're not alone because there's lots of people in that same situation very close to them. But also just saying, if you do these 3 things, you'll be making all the right decisions for this situation that you're in. And so we've been able to do that, and then after a hurricane or whatever other sort of disaster it might be, the Colorado floods, the California wildfires, we'll deploy the digital volunteers to help find resources and connect them with one another across the spectrum of things that are available to them. So the other thing that we're able to do is if someone tweets, Red Cross, I'm in the Far Rockaways and I need a peanut butter and jelly sandwich, which is a fun example, not real. We can pinpoint some of these tweets and route them through to our mass care, which is feeding and sheltering, to affect on-the-ground service delivery. The trouble with this particular part is that we did it hundreds of times during Hurricane Sandy, and we've done it hundreds of times in other scenarios. But the Red Cross, and I think this is probably the problem with most emergency management structures, is that our disaster relief structure doesn't have a place for incoming information like this, and dealing with it or changing action based on it. And so we are making it work, but it's sitting sort of outside of the structure. And I switched jobs because I felt like I could make a bigger difference in figuring out how to reorganize our structure and relook at the way that we make decisions on the ground and how nimble can we be. Because I'm sure you're all fairly aware that it's wild, the things I've learned since I moved to disaster services. The DRO, disaster relief operation, leadership structure sort of needs to be in place, and that takes, no matter even if it's a notice event, before you really know what you've got going on and you've ordered the right supplies and that kind of thing, it's at least 24 hours. And on the social web and in the community, they need that immediate engagement. And so it's figuring out how to bridge that gap and to seamlessly hand over all that work that's done in the immediate aftermath to make a difference in those decision making and how, whether to get bulk rakes or shovels, because that can make a pretty big difference. So does that answer your question?
Yeah, no, that's good. I'm actually going to keep it here for a second because this is an issue I think that came up in both reports. This is engagement with kind of informal or digital online volunteers, and you guys actually have a program. Could you speak a little bit more about that? How many, because a lot of the stuff you described sound very resource intensive. So could you talk a little bit about how big your digital volunteer program is? What type of training did you all have to do to bring them in? So I'm assuming that there was a process and policy development there. And I think also kind of touches on some of the issues that we see in the formal emergency management community for how to engage with these users.
Yeah, sure. So the digital volunteer program today is a national headquarters program. So there's about 160 digital volunteers who have gone completely through the training, which I'll explain in a second. And they all sort of report to the social engagement team at national headquarters. And the impetus for it was really to try to figure out a frictionless way to be involved in those things that I was talking about a minute ago. And it didn't turn out to be frictionless because, nothing is an emergency management. But what we did find was that we needed to have a certain level of trust in the people who were representing the Red Cross in engaging with people who might be in crisis. So we have what we call social basics course that's available to anybody here, or really it's meant for any Red Cross or volunteer employee to take. It's a 2-hour WebEx that we really use just to try to give everyone a little bit of confidence to engage, because there's a threshold, right, that what we've found over the years is not that people go off the rails and say crazy things, it's that they're scared to death to respond. And so we use this course to try to give everybody the confidence and all the tools that they might need to hop over that threshold. And we try to push them a little bit just to try it once so that they get over that fear. And then we have so every digital volunteer takes that course, and then the digital volunteer course, which is another 2 hours, which is a more intensive deep dive into the use of the software tools that we use, which are not any harder than like a Hootsuite or TweetDeck, but you just have to learn them. And some mental health and crisis communications training, because actually a lot of the things we're responding to are emotional in nature, and we've had probably the most, I don't want to say success, but I think that's where our engagement has sort of centered so far, and in sort of helping people, but also just giving them that little bit of confidence, again, that they're doing all the right stuff, and that we'll sort of be here and can catch them if they need any help. The other thing, though, is that we've had mental health experts come and watch what we're doing and what the digital volunteers are doing, and they found that it's actually more intense to be a digital volunteer than it is to be on the ground responding, because of the number of incoming conversations about really difficult topics. So really, we're trying to make sure that we're supporting them in that way, and that nobody's sort of getting overloaded with heavy tweets. So then we do the background check and everything. But so now this has been the process for the last year and a half to 2 years, really. But we're on the precipice of localizing the digital volunteer role, so that our chapters around the country will be recruiting and training their own digital volunteers to respond much more locally. So it won't necessarily take a major disaster for us to begin to deploy the volunteers in this particular way. And I think that will also probably help with the the accuracy and the engagement of having someone that you're talking to on that local level.
That's great. I'm curious from you two, and I saw a little recurring theme in both your reports. And there's the Red Cross has their digital volunteer group, but there's a whole host of individuals and other organizations that work to do this kind of same digital volunteer work, whether you want to call it volunteer, technology communities, digital humanitarians. And so I noticed one of the issues in both your reports was this issue of resources, right? They just, the emergency managers just don't have the resources to engage. But there seems to be, you know, this whole other labor pool that they could tap into if they wanted to perhaps kind of take on some of those responsibilities. Have you seen any engagement between kind of the formal emergency management community and then some of these DTCs or digital humanitarians? If not, what were some of the issues there in terms of?
I mean, I wanted to follow up on this resources issue a bit more, and Wendy raised some of the same issues that I saw pretty commonly. So I'm so happy to hear that you're training people, because that was one of the key things. People just didn't know how to use the technology, and they were deeply fearful of using the technology, and the technology keeps changing. So it's, you know, do we use Facebook? Do we tweet? Do I get a Hootsuite account? Like what, you know, and because it's evolving so rapidly, if you start from a place of not really understanding any one of them well, when they change, it's like you know, you can't even begin to keep up with them. So that was a problem that I saw pretty commonly. And then also, you know, when a disaster occurs, there is already generally an understaffing problem in a lot of responder communities, be they formal or informal, I think. And this lack of staff, just the number of people available who might be able to engage in this way is a serious issue. In terms of engaging with digital volunteer communities and folks like that, I mean, I think that possibility is characterized by the same problems as just engaging in social media and crowdsourcing more generally. So there's a fear that the data being offered is actually not accurate. There's also a fear that around issues of subjectivity of the data. So let's say someone on the ground, a digital volunteer reports that there's a major accident in this area. Well, is it major or is it minor? It really depends on your perspective, what you've seen before, other disasters you may have been involved in. And so formal responders may be more reticent to engage with those volunteers because they haven't received the same training, they don't necessarily have the same kind of perspective. And so this issue of subjectivity is a real issue in terms of seeing any interconnection between formal responders and informal responders.
From the survey perspective, what we saw was that there was interest in engaging with VTCs or volunteer technology communities, entities like Humanity Roads, Geeks Without Borders, et cetera. But that hasn't taken place to a large extent so far. So while there's kind of that interest, there really hasn't been that maturity. And from a structural standpoint, the integration of these entities parallels some of the challenges that we have in general with the emergency management community, kind of integrating whole community partners in terms of nonprofit organizations and whatnot. In terms of the nation has a common template for managing incidents. It's called the National Incident Management System. There's the Incident Command System underneath that, which is how we're supposed to address on-scene management of an event. And there have been one of the significant challenges to that system has historically been integration of non-traditional response entities. And so this is another element. And from what Wendy was saying before, it actually really resonates from the standpoint of CNA just actually conducted a study of ICS and NIMS as FEMA's using it, and there are we interviewed a lot of high-level folks, and there were a lot of football analogies, and one of the things is you play how you practice was something that came up over and over, and from the survey standpoint, the issue with how response adapts to information that's received through social media, that's something that's not exercised right now. So how can you expect for that to function effectively and efficiently if you haven't practiced that?
So what are some of the challenges with practicing it? Why aren't we exercising it?
I would say, and this is more from my own kind of reading of the existing literature and the blogs and whatnot, and my own perspectives is, and CNA has extensive experience with exercises in general. It's very difficult to simulate the stress that's placed on public information officers and kind of emergency management agencies in a large-scale catastrophic event. And so that's been a challenge. What you see in terms of exercises is that a lot of these emergency management agencies are saying that they are conducting exercises that incorporate social media, but for the most part, those exercises are primarily focused on kind of issuing information on their Facebook or Twitter, and they're not kind of delving into some of the more challenging aspects, like how testing out how the response entities would react to social media information in terms of adjusting their operations or incorporating that information into their operations.
I'm going to open it up for questions in a minute. I just want to ask another question we got on this topic of structure. And in particular, what role did a lot of the emergency managers you talked to, what role were they actually playing within the organization? I know very early on there was a lot of discussion at the workshop as well a couple years ago on where does this fit within ICS, like whose responsibility should it be? And at that point in time, it was a lot, it primarily fell in the lap of the public information officer. Quite frankly, a lot of these folks, they didn't necessarily have a mandate from up above. It was just something that they were familiar with and were going out and doing. So I was just curious, what were the backgrounds of the people that you interviewed?
So I purposely sampled across different kinds of responders, anywhere from heads of agencies to public information officers to on-the-ground disaster managers, and this is across police, fire, and all different kinds of agencies. And I did that in order to get a range of understandings of the obstacles or the social norms within a diversity of agencies. And speaking to that range or the diversity of interviewees, I found what actually you just said, that oftentimes still the responsibility, if there is any interest in social media and crowdsourcing, falls in the realm of the public information officer, which, I don't know if that's good or bad, because I didn't go too far down that road, but that seems to be where we continue to be right now.
That was largely echoed in the survey results as well. When we, even though we used public information officers as the entry point for the survey actually asks for routing to the individual that they felt was the most knowledgeable about social media operations in their agency. But overwhelmingly, what we found in the survey results was that that person was the public information officer. And that was where the primary residence of social media activities took place. Now, we did see examples where people did mention, in operations and in planning, like the situation unit within the context of the incident command system, but by far it was the public information officer.
So are there any questions from the audience? He had his hand up first here. Okay.
Here.
Hi, I'm Steve Birnbaum. I wear a couple of hats. I'm on the DHS S&T First Responder Resource Group, the inundation team. I'm also a firefighter and USAR tech in Montgomery County. I want to touch actually on a couple things, but one of the last comments that was raised was where does social media fit in ICS? And I want to actually bring up something that Wendy said. You said it's like the telephone, and I really agree with that. The telephone doesn't fit anywhere within ICS. It's a tool that has relevance to certain use cases and certain needs across the board. Some people use a phone, some people don't use a phone. And I think that we're not going to be able to answer that question until we realize that it's not a question that we should be even asking. I don't think social media fits within ICS anywhere. I think it's a communications tool that can be used in a whole bunch of different ways for a whole bunch of different purposes. And if we keep asking ourselves where does it fit, we're never going to get the answer, because I don't think there is an answer. Now, the other, and of course that goes back to, Sabrina, what you said with the lone firefighter not being able to use a phone. There's a lot of reasons for that. One of them is privacy of the patients, of the people we're treating. The other is the firefighter that gets off the rig has a job to do. And if we're doing a vet under search, climbing up a ladder to make entry to rescue someone, the last thing someone wants us doing is playing with the phone. There is a function on the fire ground and on larger emergencies to gather information, to gather intelligence. And they're the ones that are going to be watching CNN. They're going to be the ones that are talking to other agencies. And if social media in some way is a tool in their toolbox, not as social media, but just as a tool, I think that's where they might use it for one purpose. And the PIO has a whole bunch of other tools. Because there is this big focus on tools. And Ushahidi, I think, the sooner we let Ushahidi die, the sooner I think we can actually move on to the next tool that will be representative of what we can do. I look at an Ushahidi map, and whether as a manager or as a firefighter, I think it's useless. It doesn't give me any information visually in 30 seconds that I can use to make an effective decision. It's just the ability to stick a whole bunch of red dots on a map to show where we've collected data. I don't care where we've collected data. I care what information is needed to make a decision. And I think the sooner we get past individual tools and let some of these things that were early on that might have been useful to make a case, let them die. And let's see what the needs are for the next one.
Great comments.
So just to hop in on that a little, from the experience of the Red Cross, I think absolutely everything has come in through what we call communications with PIO, are the main practitioners so far. We've been, like I said, doing this for coming on 7 years. And only last week did I have the first conversations with actual subject matter experts within disaster services to start breaking down how we might use these same tools to do needs assessment, to execute mass care on a much more granular level than the PIOs or communications department would be interested in or able to do. So it's a long process.
Sabrina, you mentioned earlier about people not trusting the data, testing the validity of the data, and Wendy, you mentioned about the geolocation of tweets. Excuse me. I know a lot of research has been done in this area, but I'm kind of want to get your experiences and your thoughts on testing the validity of the tweet sources that you do get. How do you respond to that? How do you respond to people saying we can't trust this, knowing that most of the tweets are not geolocated? They just talk about place names. They talk about, for example, in the Fukushima, person in Tokyo may be saying we need packages of food for people in Fukushima. So how do you relate that tweet to some kind of, emergency where the boots are on the ground?
I'll say that the interviewees that I spoke to offered the solution of having data from their own surveillance systems in order to kind of triangulate that with information they were getting on the ground. And so there are all different kinds of surveillance systems that are in place that can be taken advantage of. And they didn't have really specific ideas about exactly which systems they would use, but they wanted some really very concrete, generally visual information. And so, it also made me think that perhaps photographs would be more useful than, say, text-based information in terms of crowdsourcing what was going on the ground, because they might trust that more than just a comment or a non-visual tweet, for example. So, people were thinking about other forms of information that they might trust more, but hadn't gotten too far in terms of conceptualizing what they really wanted.
There's a question there, and then over here in the corner.
Well, I kind of wanted to tag on and disagree a little bit with the comment about what the crowd is doing. I believe we're looking at the tweets versus the cloud. There's a paradigm shift in computing, and if those of us who were helping during Egypt knew it wasn't just as much about what they were doing on Twitter, but they were able to categorize on spreadsheets the name of activists when they were captured and not, and it was promulgated to 12 servers, so a central authority couldn't knock it down. And the use of the crowd in using this social media tool for emergency managers is a totally game-changing thing that has happened. And some emergency managers have totally embraced it, and others, just look at the District of Columbia and the recent crisis. If someone in this room can name me the POI of DC, I'll give you $5. We know who the police chief is, but we have an incident command system and they're not even following it. So what the crowd is sometimes doing is pushing the legitimate authority into a better use of technology. I'm also a member of Ushahidi, and we are changing the interface. It's the development that is happening. And because like everything else, this is a first generation. Anybody who's telling you they're a social media expert 10 years out of something is not. So let's just wait and see, but remain open and participate with each other.
Thanks so much for the panel today. It was really informational. I work in international emergency management, and while we have your expertise at the table, I wanted to ask if resources were not an issue, how would you best integrate response into like local jurisdictions? Is it something in terms of needing to move beyond a PIO and have a responder that is getting audio information, or some kind of checking system, or just do we need smarter software, better platforms? But and I just open that up. But in an ideal world, oversimplifying it, what would you have now?
I think that's definitely a part of it, is moving on beyond, we've been saying at the Red Cross for 3 or 4 years now, that we want for social media to be part of our operational DNA, which means getting it, in the communications and PIO world absolutely plays a key role, but having other areas of the organization also adopt the tool, right, like the telephone. And I think that's part of it, and what I was just talking about in really making sure that everybody in needs assessment, in mass care, in the various incident command areas sees looking at this kind of incoming data as part of their job. And there's room built into the structure for doing that. I think it's not necessarily a technology issue as much as it is how are we organizing ourselves and what is our philosophy about serving this community. And really I think even bigger than that is that it's not about how well the structure, the emergency management structure is responding, but how well have we as a community created resilience by our network with one another to help each other in those immediate aftermaths, to come together, and whether it's within that same community or someone in Texas helping somebody in Oklahoma by using these tools. I think it's a letting go of and including the community much more in the kinds of work that emergency managers do. And it's really hard for the structure of emergency management to allow that to happen. So I would love to see just everybody taking a big, deep breath and letting it out, right? And saying, let's work together.
I guess one of the questions that we kind of skirted around it a little bit, I'd be curious, we keep talking about, a tweet saying this, a tweet saying that, looking at the picture, but we're talking about vast amounts of these tweets, right? And it's those little informational nuggets that are like maybe less than 1% of what actually gets talked about around a particular disaster. If you look at any disaster hashtag, and 99% was there's garbage. How are you, and I think that might be one of the questions, how do you all taking that information, how are you distilling that down to what should or should not be acted on versus A, what's relevant, B, what can be trusted. And then I think, I don't know if you are there yet, and then so it seems that's part of the translation piece. And I would guess that's probably part of the reason that a lot of emergency managers aren't even ready to even consider that type of information. Is, you know, where do we begin? It's not just looking at like a tweet or two.
Yeah, so we collected, or we're looking at information in these really big buckets today about, you know, who needs sheltering, who wants to donate, like really, really big buckets. And I think it's a matter of really just getting down to the nitty gritty and making sure that we're looking at specifically, you know, power outages, I don't have water, that kind of thing. And we're looking, so today what we'll see is, and for example, in the Alabama tornadoes in 2011, there was communities in sort of western, southern Georgia that all of a sudden, you know, were able to get themselves and some advocates together to say, we're not seeing any services here, we're not seeing any services here. So it was sort of like an explosion of 100 tweets or Facebook messages about that particular community. And we were able to, you know, cross-reference, you know, have you been there? Do we know if any of our partners have been there? No? Well, let's make it happen. Same thing in the Oklahoma and Warren Shawnee tornadoes. There's a little mobile home park in Bethel Acres that wasn't seeing so much service delivery. It was a half mile down the road, but they couldn't see it with their eyes where they were. And so it was a matter of seeing those sort of shouting. The crowd sort of starts echoing one another, and we just take a moment to cross-reference that information and change where the emergency response vehicle is by a half mile. So those are the, you know, sorts of things that we're seeing. And I think, you know, you take so much of our success or engagement has been, like I said, though, around those intangible emotional issues. It's like providing service delivery, the care and comfort part of our mission, much more than it is the physical services, right? Or getting good intelligence about those physical services. And that's the precipice that I think we're on today is, I think we're pretty close to figuring out how to do it right, but we haven't yet.
So Clarence, I actually want to follow on. The Office of Naval Research, and I know others, are developing automated systems to monitor the social media feeds and filter out. So for example, I think Sandy, there were 20 million tweets, and they were able to narrow it down to the few thousand that might have actionable information, and then they go to the trusted volunteers to help sort through that and bin it into medical care, shelter, other assistance, etc. So you've been waiting very patiently to ask your question.
Actually, part of this discussion answered part of the question, but I wanted to know if there's been any thought given about how to integrate the social media with demographic groups, cultural age, name the demographic group, because there's been a lot of studies in the last, especially around the Katrina time, the impact of disasters on different cultural groups, or vulnerable population, whatever the term of the day is. How is there thought being given to how to integrate that? Because I know some groups, they're not just late adopters, they're non-adopters. And so how do you figure that in as you use social media?
Yeah, I will say that I know, maybe this doesn't answer your question exactly, but one of the, from a kind of research and both a practical perspective in terms of when we start this conversation about operational usage and allocating resources based on data gathered from social media streams, one of the things that you do need to be careful about and really keep in mind, and I know some researchers are looking at this issue, is around kind of those exact demographic questions, right? Just because you heard from 100 people who have the ability to get on Facebook and shout at the top of their lungs, we don't have services. In some sense, you from a PR perspective, you want to quiet that down. But is that really where you need to be allocating services, or is it just that those people in that community had access to these technologies? And so I think it's a very relevant question. I don't know that folks have exactly figured out how to balance those, because those You
The
did-
media play.
So Jeanette Sutton, University of Colorado, Colorado Springs, and some of her colleagues are doing that research on the biases in the social media data.
Yeah, Kate Starbird at University of Washington is also doing some work.
I think just to plug the World Disaster Report, there is a heavy focus on digital divide analysis in that upcoming report too.
And the rollout for that is,
October 17th.
so will it be webcast?
There will be an event on October 17th, I think, for webcast with the Harvard Humanitarian Initiative. I think if you look at hashtag WDR 2013, you'll find that information.
Thank you.
Yes, thank you very much. I'm working with a research institute over at the National Defense University, and over about the last 6 months, we sort of sent out a call to our network, which includes a lot of people who are working in disaster relief, these sorts of areas, asking them what they knew about what we were calling disaster apps, which are applications similar to social media, but not just limited to Twitter or these particular feeds. Very quickly, we rounded up a list of about 100 different applications that are out there, and I know we've only just barely scratched the surface. And as we sorted through them, they fell into certain categories. The one I particularly liked was the people finder category. There are at least 5 or 6 of those out there, and if you think about this a little bit, you realize that the more people finder databases that are out there, the fewer people will actually be found. So if I'm a if I'm an emergency manager trying to figure out how to dip my toe in this water and figure out what I should be applying, which tools I should be using, you rapidly find it becomes very, very hard for somebody to make such a decision in any case. Is there any known capability to sort through these, consolidate them, perhaps give a seal of approval, something like that? Does anybody have any particular point that they want to make on that?
It's such a pain point.
No, other than echo your concern, I think I almost, you know, you have these random hacks of kindness events or these various kind of hackathons, and the next big thing is always, oh, well, what disaster app can we do? You know, or are we constantly reinventing the wheel around a particular disaster? I don't know that there is a solution yet. I do worry about this. I actually got into my formal graduate school work was around issues of competition and coordination among humanitarian relief organizations. And I think you've seen some progress in that space, but you know, as this kind of new technology and like the excitement around, you know, creating new apps, you know, creating a new place where people can go and post information online. I think it's all great that everyone wants to help and be a part of this, but I see kind of, in some senses, the same thing that drives it all, egos in some sense. I mean, it's a desire to help, but, you know, everyone kind of wants to say, you know, I did this, I did that, and it's beginning to get a little disconcerting to me. But there are certainly some initiatives around trying to bring a lot of those folks under the same tent, but I still think that maybe we're just at a really early stage where we need a lot of this kind of innovation and competition, and then hopefully something wins out. But I share that concern as well.
Well, he can come to the next Random Hacks of Kindness, December 7th and 8th, and have someone make that app that you can check other apps.
So I would also say that I've been just having this thought, if you'll indulge me for a minute, over the last couple of months, which is that human beings seem to really want to be aggregators of information and see the whole picture all the time, and so that's how organizations begin to act too. So once someone has one app or one data set, the next group says, well, we'll aggregate that with this and put another layer on it, and there's no end to that, and I feel like we might have to start to embrace or accept the beautiful chaos of disparate, decentralized data and lean into the strengths that brings us rather than trying to always see the entire picture in every data point. So I don't know what the answer to that is. I just feel like in the same way we're not asking the right question about where social media fits, we might not be asking or heading in the right direction to try to aggregate all that information together.
Well, I think that we can do a lot with some exchange, because touching on that, a lot of the times the people that write those apps that go to the Random Hacks of Kindness are not the people that the end users tend to associate with socially or in their normal circles. So what I see is a lot of the Random Hacks of Kindness is a lot of people see something on the news and they say, oh, we're going to go develop something for the need that I saw in the news. and then there's some frustration when it doesn't get used, because they never talk to the potential user. So maybe what we can do is figure out how we can bring those two groups together.
We've got a couple of backlogged questions.
I think this sort of follows along with this discussion. I've heard a number of times now the issue of the validity of the data. How do we make sure that it's usable by formal disaster responders? And I'm wondering if there is a role for some organization like the Red Cross or somebody else to sort of say, hey, we will be the central point. We've got people trained. We will try to cull the information coming in and then provide the stuff that we think is more useful, kind of like you were saying the Office of Naval Research is doing, to say, now formal responders, these are the ones we think we should act on, or that kind of thing. And is that just completely ridiculous? Because it seems like training everyone out there to be able to use all these different and evolving technologies, that seems impossible. There's no way all the responders are going to be able to do that. At least that's what I see as the problem here, is nobody can be up to date, but maybe one organization could be. Not to put it all in the Red Cross, that was just a suggestion, but not.
Yeah, I mean, I think the moment that the Red Cross says that's what we're doing, someone else will come along and say we can do that a lot better. And so it doesn't really stop this cycle. But I think, I mean, you're right. There is a lot of lack of resources